Okay, good afternoon, everybody. I'm Peter Zanoni, the City Manager of Corpus Christi, and today we have our Wednesday briefing for you to provide the community an update on our COVID-19 situation here in the city. And presenters today will include myself, and then we're going to go to Mayor McComb, who's here, and then after Mayor McComb, we will have Annette Rodriguez, our Public Health Director. And then I've asked Dr. Bird from Texas A&M Corpus Christi to join us today. Normally he joins us every Friday, but given that we've had a pretty significant number of new cases each day now for the past, a week and a half, almost 2 weeks really, we want to give the community an update on what's going on in terms of number of new cases in our city, but also in the coastal Bend region, in the state of Texas, and in some of the other states, because certainly there's an outbreak situation that's underway, and we just want to make sure the community knows about it. And then following Dr. Bird, we have a video recording from Nueces County Judge Barbara Canales. You may have seen the news, and not only is Judge Canales, but the rest of the county commissioners, the other key executives over there, to include their attorney, their auditor, the sheriff, are all in isolation or quarantine. They were exposed last week in one of their commissioners' court meetings to an employee who subsequently tested positive for COVID-19. And so out of the abundance of caution, they are in isolation for the next 7 days. This situation happened 7 days ago, so they have 7 more days to go until that 14-day period is reached, and they want to keep other persons safe. Judge Canales was tested, as many county employees were today, and Judge Canales did test negative, but still with the virus, you can test negative one day, but in that 14-day period, test positive the next day. So good news is she has tested negative, but out of the abundance of caution, she is going to remain isolated. But she did want to communicate to the community today, as she normally does, so we do have a video that will show from her talking to the community after Dr. Bird speaks today. Okay, so that's our lineup today. Thank you for those that are covering it, and this is watched on YouTube and Facebook Live, and we appreciate those watching. We want you to understand the information, but also share it with your friends, family, neighbors, churchgoers, and so on. Okay, so what I'm going to do is kind of run through some of the statistics as we generally do, and these are probably more important than ever, and Dr. Bird has a good set of statistics too. The screen you can see here, and zoom in if you need to. I'm going to go slow so you can use the graphs to kind of see the stats. But the statistics say more than just a bunch of words up here. So we want the community to understand the statistics, to see for themselves what's going on. So what this graph shows is a Monday through Friday snapshot for the past 2.5 weeks. There's a red line here, right, denoting the 2 weeks. And so what you can see is 2.5 weeks ago, things were kind of going okay. This is pretty typical over the past couple of months where we've had 0, 5, 1s, and 3s. What we started seeing though, 2.5 or a week and a half ago is an 11. That's on a Monday. So, that's typical where a weekend testing reporting may not have happened. Mondays typically have been higher from the weekend effect, we called it. It's not that more people are getting the virus, it's that information's coming in better on a Monday than it would on a Saturday and Sunday when entities are closed. So Monday, Tuesday, a 3, but then Wednesday, a week ago, 7, then 11, then 15 on Friday, and then nothing on this graph over the weekend. And the reason being for the community that's been following this is a lot of the commercial labs, hospitals, even our own lab, have fewer staff on the weekends as the COVID pandemic has kind of trended down and people have lost interest in it. So have the entities in terms of having them work on the weekend. And so that we weren't getting good data on the weekend, so we said, you know what, let's just not report on the weekend since it's not really the best data, it's not a full picture. And so we're just putting everything into Monday, and that's typically what has been happening more and more over the past couple of weeks is private labs and others were holding back the information and then just giving it to us on Monday. So we've gone to that model. So Monday of this week, 24, a big 31 yesterday. That's our highest number ever since we've been counting here in Nueces County. And then today, a new number of 29, so still pretty consistent and still pretty problematic. So that's it for the trending there. We're going to show you some 7-day trends, and Dr. Bird has some other trends as well. Okay, when we look at the next graph, which is our, we have the daily counts, and this does include the weekends. But the key thing to focus on is the red line. And that red line is our 7-day average. And so it's a 1-day, it's a 1-day average, it's a 1-day count over the past 7 days, a 7-day average. So what you can see on the tail end over here, I'm going to point it out, is that 7-day average is going up substantially. So today, the 7-day average for the past 7 days, the past week, is 16 cases per day. That's a 7-day average, 16 new cases every day in Nueces County. You can see down here when we were doing well, there was very few new cases a day on average. And this was the 2 outbreaks that we had here from our meat processing plant and some of our senior care facilities. And now we're down here at this end, pretty close to those outbreak areas, but the big difference, and this is important because we've gotten a lot of questions on this, the big difference on this spike is there is no outbreak area. It's community-wide. It's not in one part of town, it's not at a processing plant, it's not at a senior center, it's everywhere. And I'm going to show you a zip code map here in a little bit. So that's a key thing to know. So the health precautionary measures that Annette's going to talk to us about are more important than ever because it's more widespread than ever in Nueces County. Okay, the next chart shows testing. So this has been important, especially early on when we started ramping up testing. So testing's continuing, and in fact, it will be even more so in the coming weeks. The judge is working with us and with our health. It's a joint city-county health district. Testing has remained pretty consistent this week. Our 7-day average is 125 tests performed each day. That's a 7-day running average. So 125 people are being tested, and that's much better than where we were way back here, where the average was probably half that. Okay, and then you're familiar with our donut. While we talk about new cases, we do want to point out that there's a recovery scenario where people do recover. And so of all the cases we have today, which is over 400, 51% have recovered right here at 213, but we still have 50%, about 203 that are active cases. Now, on this donut chart, the most striking thing is the number of people in the hospital found in the upper right corner, right here. So we have 18. We've never seen that number before. Since we've been using this chart, it's been 6, 4, 6, 8 was the highest I think we've ever had. Today we're reporting 18 people in the hospital, so that's an issue. 3, though, good news, only 3 are in ICU, which is good. That means they need more intensive care, but still 18 in the hospital is a significant number. It's the biggest number we've ever reported. And then if you were watching this last Wednesday and you haven't been following things, we did have an additional death. So the bottom of the chart shows 4 deaths. We had 3 for the longest time, but we did have another death in Nueces County, so that puts us at 4. And that death happened recently over the weekend, so we reported it Monday. And so that's added to this graph. Okay, we wanted to add a couple new charts, and I'm going to show you these here. A lot of people have, well, the key thing to point out here is cases by age, and what we're seeing is that if you look at the lines, there's a yellow, a green, kind of a maroon, an orange, and then the brownish line. If you focus on the far right, this shows number of cases a day by age, and you can see the case amount here. And so what you note is that the yellow line is spiking much higher than any of the other lines. The lines indicate an age range. And so the yellow line age range that you might be able to see down here is the 20 to 39-year-old age group. So that age group is spiking or contributing to the positive case more quicker than any other age group. that the 20 to 39-year-old person has more positives each day than any other age group, is another way of saying it. The next or the second highest in terms of rapid increase in number of new cases is the age group that immediately follows that, so the 40 to 59-year-old age group is contributing significantly to the daily number of new cases. And then the other three are kind of, even though they're going up, they're not spiking up as much. And so that includes the 60 to 79 age group. The lighter orange is the 0 to 19 age group. And then the brown on the bottom is the 80-plus age group. So the message here is that the 20 to 39-year-olds need to listen to Annette, who's coming up next. And we need to get that age group back into compliance in terms of social distancing, staying at home if they can, wearing face masks, washing their hands more often, just being aware that this thing is nowhere near gone, and there's still a lot of territory to cover in terms of staying safe. Okay, and then the final graph we want to show you is a zip code one. Let's see how it looks here on the screen. We just have to advance to the next slide if they can. There we go. Okay, so this answers the question. We've seen a lot of it, and I don't know if it's hoping for a better answer, but people hope that the big number of cases is from some type of a isolated incident, right, like at a processing plant or a senior facility. But over the last week and a half, that has not been the case. What it is community-wide, each zip code is seeing pretty consistently the same number of cases, new cases. And I think if you look at the graph, even if you can't see the legend, the reds is a number of cases distributed by zip code. It's a 30 to 46, or a 20 to 30, or a 10 to 20. And so all those zip codes seen here, these here, have more cases, right? But you can see there's numerous parts of the city that are pretty equal in its distribution in terms of number of cases, right? All these are consistent. This here, the island, Flower Bluff, other areas along Ocean Drive, up here, all pretty consistent in terms of number of cases in the zip code. The two lighter ones here in this like a brown color or greenish color, the top one is the industrial district, where our refineries are, so there's no population living there. And then this other one is a lot of agricultural land. There's very little population there as well. So without even knowing the legend, what this shows you is it's a pretty red map, right, across the board, across the city limits, which means there's a pretty consistent number of cases across our city. And that answers that question, is there a particular zone we should not go to, right, to be safe? And the answer is no, there isn't. There's cases everywhere across the city. And so you have to do those things that we've been telling you about to keep safe, which is wear a mask, keep your hands clean, social distance, stay at home if you can. I'll just read off some of the zip codes in case folks want to know, but they're all 7/8s, but 401 has the highest, 46 cases, 412, 43, 414, 42, 78415, 33, 413 has 29, 78404, 27, 411, 24, 78380, 22, 78405, 22 cases, 78416, 21, 418 is 21, and then we'll stop here. 410 has 16, and then there's a few others in the remaining zip codes. I might as well finish them off. I guess 783, 7313, and then 78409 has 12, and 78408, 7. And then there's a few others in the single digit. So that's the message on that chart there. Okay. Okay, so with that, that gives you a statistical update, and Dr. Bird is going to give us a little bit more perspective in terms of the region, the state of Texas, and other locations across the country. And Annette is going to talk about health precautionary measures, but we're going to have Mayor McComb come up and give us a little perspective as well, and we'll go from there. So, and Gabby's going to translate my portion. Thank you.
En resumen, las cifras más recientes indican que en las últimas 24 horas se han reportado 29 casos confirmados por el coronavirus, haciendo un total de 420 casos. La mayoría se encuentran en el rango de edades entre 20 y 39 años. 213 de los 420 casos se han recuperado por completo. 18 personas continúan en el hospital. De esas 18, 3 personas están en la unidad de cuidados intensivos. 203 son casos aún activos. A la fecha se reportan 4 fallecimientos en el condado de Nueces. El día lunes fueron 24 casos, el día martes 31 casos, haciendo así la cifra más alta desde que se ha reportado el coronavirus en nuestro condado. Estas cifras han aumentado el promedio semanal a 16. Este promedio no se debe a ningún brote nuevo, sino de contagios en la comunidad. Las pruebas van a continuar realizándose y posiblemente aumenten. De acuerdo a los códigos postales, los códigos 78415, 78412, 78414 y 78401 han registrado un mayor número de residentes afectados por el virus. Este mapa e información adicional se encuentran en el portal de la ciudad www.cctexas.com/coronavirus.
Good afternoon, Mayor McComb. And before you get excited, I've got my mask, but while we're up here, we've got the distance, and so I'm probably hard to understand without a mask and worse with a mask, so I don't have it on right now. But we are seeing an increase in positives. I can't explain it, don't understand it, other than the fact that we're seeing the numbers go up. And so we want to continue to encourage you to do what you may have slacked off doing because we had such good numbers for such a while. But our numbers right now, relatively speaking, positive tests to the number of tests given is now at 3.2. We were down under 2% or 2%, under 3% at 2.67 some last week. So we are moving back up, but and that's still a relatively small number, and it's a good number. Particularly compared to the rest of the state, but right now we're worried about Corpus Christi, Nueces County, and we really hate to see that number tick up. Cameron County, the state I think has 6.1, 6.2, maybe even more after today's numbers come in. Cameron County 6.6, Bear County's 5.9, Lubbock County 4.9, so we're still relatively low, but we want to get this trend going in the that last little number that we saw on that chart, it was starting to go down, and I hope it drops real big in the next few days, if not tomorrow. But the most effective way we can do this, and you've heard us before, you know, we don't have an order from the governor telling us to do this, and we're adults, or the adults that are in charge of young people. These are decisions that we're trying to ask you to do on a voluntary basis with as much encouragement as we can. We haven't mandated that you wear your masks. We haven't mandated that you wash your hands. We haven't mandated you don't touch your face. I think people like freedom to make choices. I just hope you're making the right choices, and we'll continue to do that. I think there's been some degree or a sigh of relief when we did start opening the state, thinking we might have crossed the threshold, but it appears that the virus has let your guard down and let it come back and grab you. So we want to make sure that we reemphasize that. There's no mandatory requirement that you wear a mask, but we certainly encourage you to do that whenever necessary, particularly in going into gatherings. We have a big city mayor's conference call each week, and this topic is always a conversation we have, and all of us around the state are concerned about the increase in cases in our communities. We're monitoring the hospitals. The governor's monitoring that. We still have capacity, but if we keep getting numbers like this, it's going to begin to have an impact on our capacity and our ability to deal with it. So we're asking you to rededicate yourself to doing what we've been asking you to do for the last 3 or 4 months and help us win this thing. In the governor's speech or press conference yesterday, and I think the chart bared it out, and it's what Mr. Zanoni showed, is the substantial increases in numbers are coming in the age group from 20 to 39, and I think there may be a correlation in the fact that the more open we are, the more we're getting out to go into restaurants and bars, and they're just getting taking advantage of not paying quite as much attention to the social distancing and the wearing of the mask. So we implore you to pay attention to your surroundings and do these simple things. They don't cost any money, just a little bit of time, and it can make a lot of difference. If you're interested in getting ball games back up and going, hoping school starts on time, you continue to be able to go to your restaurants, then we're going to have to, on a voluntary basis, get back in this, because I don't think there's any question in my mind that if it gets to a point that the governor may pull the trigger and request that we stay at home again, and I don't think any of us want that. So my plea to you today is to re-energize yourself and paying attention to what we've been asking. We want our county to be the leader in the state, and so we want you to take that into account. And I think that there's nothing that brings it home more visually is the fact that nobody's immune by virtue of the fact that I'm here and the county judge is not, but will be on a video shortly, is that no matter who you are, what you do, and she's been very dedicated to following the protocols, but when you get around and you start moving around, everyone is subject to it. So we hate for that to happen to the judge and to the folks at the county, and we wish them well in this quarantine period and hope none of them come up positive and have a speedy recovery for those that do. But this is a non-discriminatory virus. Doesn't matter what your age, ethnicity, religious beliefs, whatever those are, it doesn't care. If it just finds a place to attack, it attacks. And so that chart bears that out. So everybody's got a role to play. And one of the beauties of a free society is that people get to make their own decisions. And if we all make the right decisions, we can get our community going back and get us healthy as quickly as possible. So we encourage you to pay attention to that. I would remind those that that have decided that they're going to go to restaurants and bars and spend a little more time, based on what the governor has said, and I think I saw this on the news last night, that he has said that they will be checking these locations to make sure they are in compliance with the rules and regulations for which we are being operated under. And if they are in non-compliance, they will have their license suspended for 30 days. And if they're caught the second time, it will be for a longer period of time. So if for no other reason, if you want to be able to continue to go to your bars and restaurants, then you need to pay attention to this, because they will be shut down, and the governor is very serious about that. They've got the licensing to do it, and they've got the authority to do it. And if they're not in compliance with the social distancing and the other issues, then they will take steps if they be able to determine based on the statistics that that's where a big issue is taking place. So we want you to enjoy yourself, enjoy your freedoms, but also exercise good judgment and keep those bars and restaurants open, and that's the best way to do it. So I'll turn it over to Annette to bring us the daily statistics, what other information she has from the health department. But, the future success of this whole process is dependent upon you, the public, and we can just simply be here to help and give you the information and be a cheerleader for you and encourage you. But the quicker we can get out of this, the better off all of us are going to be. So stay healthy, stay safe, and stay vigilant in following the procedures that have proven to be the most effective at this point. And that is, you get tired of hearing me, but I think I've got it pretty well memorized. Wash your hands, don't put your hands in your mouth, social distance. If you're healthy, stay away from sick people. If you're sick, don't go around healthy people. And it's a pretty simple combination. Doesn't cost any money, just a little common sense. And I think all of us have some of that, and we'd like to use it. So thank you very much. And Annette, if you'll come in this time.
En resumen, hemos visto un aumento en los casos positivos. No lo podemos explicar, pero le quiero pedir que haga su parte para evitar más contagios. El condado de Nueces está registrando un promedio del 3.1%, que aunque es bajo comparado con otras ciudades, va en aumento y queremos que esta minore. Quiero enfatizar que no existe una obligación para utilizar un cubrebocas, pero le sugerimos que haga lo posible y tome todas sus precauciones de salud, mismas que le hemos sugerido por los últimos 3 meses. No queremos regresar a las órdenes anteriores, pero esto puede ser una posibilidad si las cifras no aminoran. Recuerde, este es un virus que no discrimina y cualquier persona puede contraerlo, por lo que le pido que haga una buena decisión. De acuerdo a las órdenes del gobernador, los bares y restaurantes deben de seguir las reglas, ya que de no hacerlo, pueden perder su licencia por varios días hasta ser revocada.
Thank you. Annette Rodriguez, Health Director. So yesterday, the Health District conducted a drive-through at the Old Memorial Hospital parking lot. There were 41 samples collected. Today, there was a drive-through at the Health District and 45 samples were collected. The Health District's next drive-through is tomorrow at the Old Memorial Hospital parking lot with over 100 people already signed up to go through our drive-through. We have also extended a drive-through for this Friday, and we have another drive-through scheduled for Monday. If you have COVID-19 symptoms, please call our 826-7200. We did have trouble with our phones on Monday, and we apologized. We are seeing extended wait times currently, so be patient. We're moving people around to get more people to answer phones, and we're staying late to make sure to get you into one of these drive-through. There are other options for community testing that include the CVS Pharmacy, the Health District, of course, the Amistad Clinic, the military testing, and you can also visit the texascovidtest.org. So the Corpus Christi Nueces County Health District did confirm the fourth COVID-19 related death in Nueces County. The patient was a male between the ages of 60 and 69. He was tested positive for COVID-19, was hospitalized in mid-May. The patient had few comorbidities, one being controlled hypertension or high blood pressure. From our deaths, we have lost people in their 30s, in their 70s, 80s, and now a person in his 60s has succumbed to this virus. Our sincere condolences go out to his family. Since last week, there has been a rise, as City Manager Zanoni mentioned, in COVID-19 cases, and the one additional death due to COVID-19. We had 24 positive cases on Monday, 31 cases yesterday, and 29 cases reported today. These cases are not in clusters, they're not in a particular business, they're not in a particular zip code or area. These cases are widespread and are consistent with community-acquired infection. Currently, we have 18 hospitalized patients in Nueces County with COVID-19. We are in great need of convalescent plasma. So if you are recovered from COVID-19, we ask that you please consider donating. The Coastal Bend Blood Bank has been reaching out to individuals that have recovered to see if they will donate blood, and many have said yes, but people need to come in to actually donate the blood because the hospital really needs this blood. It helps the individuals in the hospital have a much quicker recovery. Donors can call the Coastal Bend Blood Bank at 361-855-4943. Considering the increase in cases, the general public is strongly advised not to abandon or relax the strategies that we have been using these last few months. Continue to be responsible and practice social distancing by staying at least 6 feet from others and avoid close contact with people who you do not know or generally do not associate with. As more and more restrictions are lifted, we know there are many options to exercise freedom while also exercising caution. Use all available strategies to reduce your risk of contracting COVID-19. We will not be able to function as normal until the disease is no longer spreading in our community. For now, if individuals continue to exhibit risky behaviors, then our numbers will continue to rise. We do not want to see this happen, so we strongly urge everyone to consider your behaviors when shopping, dining, entertaining, and socializing. When going out into the public, use a face covering, period. I used to say use a face covering when in congregate settings, just use a face covering when you go out. Face coverings are recommended by the Centers for Disease Control and Prevention for adults and children over the age of 2. This is a prevention tool that protects you and everyone around you. Maintaining good hygienic practices and practicing public health strategies are the best defense we have currently against COVID-19. Continue to social distance, social distance, social distance. This is key in keeping our community safe. Thank you.
En resumen, ayer se llevaron a cabo la toma de muestras de 41 personas. El día de hoy fue de 45 y tenemos a más de 100 personas registradas para los próximos días. Recuerde, existen otras opciones para realizar la prueba, ya sea en el centro de salud, la farmacia CVS sobre la calle Alameda, la clínica Amistad y las pruebas militares. Como le informamos, contamos con el cuarto fallecimiento el fin de semana y le enviamos nuestro más sentido pésame a la familia. Debido a los casos adicionales, solicitamos el plasma de las personas que se han recuperado, ya que es de suma importancia para atender médicamente a los enfermos. Para más información sobre la donación de plasma, le pedimos que llame al 855-4943. Ahora más que nunca, todos tenemos que hacer de nuestra parte. Les recordamos practicar el distanciamiento social a menos a 6 pies de distancia. Asimismo, utilizar un cubrebocas para las personas mayores de 2 años. Lávese las manos con agua y jabón durante al menos 20 segundos. Evite tocarse los ojos, la nariz y la boca con las manos sin lavar. Evite el contacto cercano con personas que estén enfermas y si está enfermo, quédese en casa.
Thank you. Good evening, everybody. We're going to try to keep this pretty short, but give you some context on what's happening presently and why it might be different than what we were going through about a month ago with the meatpacking plant and transitional housing outbreaks that are occurring locally. I'm part of the TAMU-CC COVID-19 modeling task force. I'm here on behalf of a lot of different people. Our purpose is to address your concerns about COVID-19 and the interventions that are taking place in the Coastal Bend area, and to enable evidence-based decision-making by our leaders rather than just going with our guts. So this is a review of the cases as they stand for the Coastal Bend area. It doesn't include the new number for today, but 507 cases across the entire Coastal Bend. And what I want you to pay attention to is this was the meatpacking plant and transitional housing facility outbreak. And now we're in a new stage where we're in a more community-wide, and I'm going to call this a Texas-wide outbreak. It's not quite as steep, but it is going up. There's about 294 recoveries presently, but if you look at the active cases, you can see we've gone up and down and up and down, and now we're headed back up again with the active cases. And 5 fatalities right now in the Coastal Bend area. It's only ticked up by 1 over the past month and a half or so. Now here's the context. So that's the Coastal Bend. What happens if we step back and we look at more areas in South Texas? This is Public Health Region 11. It includes Laredo. It includes McAllen and Brownsville. And these are metro areas in the South Texas region. And while these numbers represent the whole county in which these cities occur, we're giving the name of the city just because maybe it's a little bit more relatable. So you can see that for us here, Nueces, compared to McAllen, Laredo, Brownsville, we have fewer cases overall, and this is on a per capita basis, total number of cases per 100,000 individuals, whereas we might expect Portland and Aransas counties are below Nueces County. So that gives you a little bit of context where Nueces is kind of mid-tier, but there could be a lot more cases if you look at Brownsville and Laredo. If we look at this a little bit differently in terms of new cases per day, what these lines represent are statistical smoothing lines through the data. The data is fairly noisy, so we do this to make it look a little bit cleaner. Again, what you see is that in every single one of the counties, we have an upward trend over the past couple weeks. It started right around Memorial Day, if we trace it back through modeling. And since then, we've kind of been on an upward trajectory, leveling and then going up and up. And that's what an exponential rise looks like. At first, you can't quite tell what's happening, but as time passes, the jumps get bigger and bigger. And all of a sudden, we have 31 cases yesterday, 29 cases today. Those are huge numbers. We've never seen numbers that high, even with 800 people at a meatpacking plant all getting tested. We didn't see that many people coming back positive in one day. So this is different. It's not just in Nueces or in the Coastal Bend. It's all over South Texas. And it's not just all over South Texas, it's all over Texas itself. So these are different regions of Texas. They're split out into the public health regions. This is us, Public Health Region 11, which I called South Texas with the black background over there on the side. And so these different regions, and I put in a famous city or a well-known city in each of these public health regions to help tune you in to where we're talking about, because sometimes the county names aren't as well known. So Longview up here in the northeastern corner of Texas is trending upwards pretty strongly. I think this huge trend upwards might be connected to a correctional facility or a prison where a huge number of cases was added all at the same time. Austin trending up, Houston trending up, Dallas trending up, El Paso was trending up, maybe a little bit more leveling, us trending up, San Antonio trending up, and then Amarillo, the only one that's really trending down right now. But they've perpetually been higher than almost every other part of Texas before now, which you can see there in the past. So again, this is per capita, new cases per day. You focus over here, all of Texas is going up. It's not just the Coastal Bend area, it's not just Nueces County. And so this is different than what we faced with the outbreaks that we had about a month ago. See, the tests per day, I know you saw this already, but this is a little bit different way of looking at it. These tests here, and I think it's easy to get lost in these points and the numbers. Every one of these points represents a number of people that are getting tested, and the points can be different. These points here were from people mainly that were from a census survey of everybody at a few transitional housing facilities and at the meatpacking plant. And then we had a lot more tests due to censusing everybody at the nursing home. So those points are different people than were here. And underneath there was kind of everybody else that's getting tested in the Coastal Bend area. And so that's where we are now. We're over here, we're not census surveying nursing homes anywhere. That's been done. And as Annette said and Peter said, there's no one place where we're focusing on that we can identify here's where the outbreak is. Here is Texas, is where the outbreak is. It's not just in one building or at one business. There's been about 125 tests per day. I didn't calculate the average there. I just kind of eyeballed it. Peter said it's 125. I believe him. What I think is important to think about now is we've been steady for about 12 days there at about 120, 125 tests per day, and we're getting 30 cases that are coming back positive. Now there's an offset, right? So these positives we're seeing today were tested a few days ago and showed up in the data a few days ago, but it was 120 tests, most likely, that produced those 30 cases. That's a 25% positive rate, which is really high. And it's one of the ways that we know that this is not just normal or something that we think is going to subside without maybe additional changes in behavior from everybody in the community. This is the average percent test positive per day. And because the data here is messy, and I want to emphasize to everybody that we do the best that we can with the data that's available. But across the whole country, the data is not perfect. So it's hard to line up the number of tests, and of those tests, how many came back positive. So what we do know is how many tests were done, and we know how many people are coming back positive, and we do some averaging. And all these points, I would say, are equally biased, so we can compare them to each other. Notice we don't go farther back than about May 1st, because I don't trust any comparisons before that point with the way that your ability to get a test was affected. Before April 21st, you might not get a test if you didn't travel. After April 21st, you could get a test if you traveled. Now, pretty much if you want to get tested and you're showing symptoms, you should be able to get tested, and that's why we can compare. So here's the STX outbreaks and the transitional housing outbreaks. Here's where we are now. And that's on this averaging way of calculating it. And I told you straight up, you can pretty much take the number of new tests, divide it by 120, 125. That's the percent positives that we're coming back with right now until the number of tests changes per day. So I pointed that out, local outbreaks, Texas-wide outbreak. This data is from Nueces, but it's not just a Nueces outbreak. Something I was asked to present on is the transmission rate. Remember, the transmission rate is how many people does a contagious person infect with COVID-19. So without any interventions, our estimate right now is around 3.1. This is for the Coastal Bend and South Texas area, but really this is for Coastal Bend, what I'm presenting right now. And any good model is not an exact replication of reality. It's a simplification of reality. And so what we've done is we can fairly well model the way that this pandemic has proceeded in the Coastal Bend by modifying the RT in this fashion. And when we do this, the model predicts the number of cases that we're seeing per day fairly well. And what you can see is that schools closed, we're on a downward trend. Stay-at-home began, we went below 1. 1's important because when less than one person is getting infected from each other contagious person, that means COVID-19 is shrinking. Because you can't help but some people aren't going to transmit it. That's the way that it works. So we were at that point in the middle of the stay-at-home. Even before the stay-at-home started, we went below 1. But before the end of the stay-at-home, we started to transition above 1. At least we can explain what happened by transitioning the RT above 1. After Easter, if we transition the RT above 1, it's about 1.1 right there. We're able to predict the cases very well. I'm not showing the cases, just showing how the RT changes. And then when Open Texas began, we initially found that there was an increasing spike. Now, probably what's happening is a slow increase in RT that was happening, or a transmission rate happening through this time. But then something happened that I didn't expect, and I had a hard time explaining over maybe the past month, where we started going down after this steady increase in number of cases that occurred from Easter on through the beginning of Open Texas. And that's where I'm putting maybe it was the seasonal effect. And you might be wondering, well, why did the seasonal effect stop? And well, it hasn't. Each of the things that we do, and something like a seasonal effect, it's like a coupon. And you can't just add up the coupons to get 100% off, right? If you have a 20% off coupon of $1, then it's still 80 cents. But if you have another 50% off coupon, then it's 50% of 80 cents, that's 40 cents. That's the way these different things that we're doing work. It works like coupons. The seasonal effect works like a coupon. So what's been happening is we're getting a seasonal effect coupon, and I put a question mark because I'm not positive about this, but something has happened since the beginning of stay-at-home that gave us a discount and caused us to go down. And the best explanation that I have is while that was happening, as we continued to open Texas, as we continued to get comfortable, we've opened Texas and nothing too bad is happening with the numbers. Maybe we got a little bit more lax with wearing masks. We started going to bars, we started going to restaurants, and we were slowly but surely ticking up above 1. And that's where we are now. If our best estimate is right now, the transmission rate is 1.6. So that would be for every one person that gets infected, they're infecting on average 1.6 additional people. That means some people infect 1, some people infect 2, a little bit more infect 2. That'll give you the 1.6. Now, it's not as bad as this, but it's enough to cause what's happening right now, and it's a very good fit. We don't have time for me to show you the fit, but tune in on Friday and I'll show it. I was asked to talk about maybe a larger context. So why is this happening now? And we use the cell phone data from unicast.com as well as from safegraph.com to track people's behavior. So just for today, I asked a student to put this together for different states. The reason why we chose Texas, Florida, and Arizona, I think is obvious. Unless you've been underneath a rock, these are the 3 states that are in the headlines right now, right? Florida, Texas, and Arizona. And that's why I was asked to say something about it. So I thought we'd look at the encounter index, and this is kind of an estimate of how close in contact people are coming with each other. And you can see Florida, Texas, and Arizona, they all have a higher encounter index than New York. The way you interpret this is 100 is normal, and 0 is 0. Nobody's coming very close to each other. And overall, these states, we're about 50% back to normal for Texas, Florida, Arizona, as well as Colorado. Now, the reason why I stuck Colorado in there is Colorado is going down right now. It's being trumpeted in the headlines as a state that's doing well, as well as New York. While New York was, the hardest hit, right now there's a very low level of activity and their number of cases are going down. So I think what the take home from this is why is Texas, Florida, and Arizona, why is it these states? It's not just something like encounters. It's not something that's different about those states. I would say in overall, What we're experiencing here is a Texas outbreak. I don't think it's a Texas, Florida, and Arizona outbreak. And something similar is just happening in those other states. And then why is Colorado going down even though their activity is close to ours? Perhaps they're wearing masks more. There's all sorts of additional reasons why this won't perfectly predict what's happening. Another way we can look at the cell phone data is we can look at foot traffic. Following up with Mayor McComb and what he was talking about, we've seen distinct upticks in the amount of activity and foot traffic at bars, at restaurants, at malls, not so much at movies. But there's a lot of lines here, right? So blue means essential, and not blue means not essential. And so you can see the essential places we're visiting more. But it's a little concerning that we've caught up with malls and restaurants in terms of normality with grocery stores. And that's the type of thing that maybe needs to change a little bit, or at least if you're going out there, you're gonna have to be more vigilant and pay more attention. I mean, I know when I go to a bar, I drink, and it's hard to drink with a mask on. So, you know, you might need to think that through and decide if that's what you wanna do. Okay, yeah, very, very plain, right? So conclusions. It's a Texas-wide outbreak. It's not just Nueces. It's not in the coastal bend. It's not just Nueces. You saw I showed Portland. I showed Aransas. They're going up. What I didn't show was Brooks is going up. There's other counties in the coastal bend going up also. We don't have enough time to show all that. COVID-19 has expanded rapidly at this point in South Texas. And here's the thing, is this is different than the meatpacking plant. This isn't just a contained outbreak. Everybody should be well commended that was associated with containing the outbreaks we saw about a month ago. We identified that outbreak, we as in like everybody in the community and all the public health officials, they contained it by contact tracing and stopped it. This can't be contained, what we're going through right now. It's everywhere. It's not in one building. It's not in one business. It's not in one town. It's in all of Texas. So we can't contact trace our way out of it. Even if we wanted to, that's kind of the policy that we're under right now. If you think about it, we're going to put out flare-ups, right, across the state. The state can allocate additional staff to one location of the state or another as flare-ups occur. Well, the whole state is flaring up for the most part right now. So that strategy isn't going to work. So this is different. On the task force, I've been very cognizant of not crying wolf. When I get up here and talk, and you notice week after week, we've seen some upticks. I said, well, let's see what happens. Let's see what happens. Well, here I'm telling you right now, I'm not gonna wait and see what's happening anymore. This is the real thing. This is our third wave. It's the biggest wave that we've experienced. And if things don't change, if our behavior doesn't change, this wave, if it keeps coming, becomes a tsunami. And that's what we want to avoid. We're already, ramping up in exponential growth, and we don't want to continue to do that. So there's too many unrelated cases with unknown causes to contain with the contact tracing. It's too widespread. And so that's where we're at. That's why this is different. And that's why everybody should be paying close attention right now. And just in my own personal, or in my professional duties as a lab manager with employees, I've asked all the employees who were staying at home before to not come in. They actually never got a chance to come in because last week I said, all right, you guys can come in. And then we never got to that point. I'm okay, stay home again. So that's how I'm treating it for myself, and we give them work to do from home. So that's what we have for today, and we'll let the translation.
En resumen, han sido 507 los casos positivos registrados por el virus en el área de la costa, sin incluir las cifras del día de hoy, y 5 muertes también en el área de la costa, la cual incluye 11 condados. En cuanto a los casos diarios, estos han aumentado desde la celebración del Día de los Caídos o Día Memorial, pero nuestro condado no es la excepción. Las cifras han aumentado en todas las ciudades del estado. La única ciudad en el estado que ha reportado una tendencia a la baja es el La única ciudad en el estado que ha reportado una tendencia a la baja es la ciudad de Amarillo. El porcentaje de casos positivos al virus es del 11% diario, de acuerdo al número de pruebas realizadas. El radio de transmisión de una persona si no toma ninguna precaución es del 3.2%. Esto ocurrió a principios del mes de marzo. El radio de transmisión bajó a menos de una persona a principios del mes de mayo. Ahora ese radio de transmisión ha aumentado a poco más de 1.5 personas. Texas, Florida y Arizona son los estados actuales en donde se ha registrado el mayor número de aumento de casos comparado a otros estados que han disminuido, como Colorado y Nueva York. En conclusión, estas cifras recientes no son el resultado de un brote, no está contenido en un lugar en particular, sino es por transmisión comunitaria. Esta es la tercera ola de casos en nuestra área y queremos evitar que se conviertan en un tsunami.
If there's any questions, I'll answer them, or anybody else has any questions. Okay. Perfect.
Oh, yeah.
Okay, great. What we're going to do at this point is Judge Canales has a pre-recorded message that we'll show on our monitors. I did, though, want to thank Dr. Bird. I was looking at my emails early this morning, and I noticed he was sending us some information at 2:47 this morning. And so his team has been working around the clock, and that was one of the best decisions we made to call Dr. Miller from Texas A&M Corpus Christi to see can we get an expert team to help us in modeling and projecting. And so we thank you, Dr. Bird, for your briefing today. We called them in as a way to kind of reinforce the message, which is we got to tighten up here. Things aren't going the way they should be. And so we appreciate the additional briefing today, Dr. Bird. They'll be back again on Friday. Dr. Bird will present as he normally does, and it'll be a more extensive presentation than today. So what we're going to do is let's see this tape from Nueces County Judge Barbara Canales, and then we'll see if there's any questions from the media.
Hello, everyone. To all my fellow Nueces County employees, I'm bringing this message to you from my home, where I am in quarantine for the next 7 days. In fact, I really wanted to deliver this message to you in order so that you had up-to-date, accurate, and full information about the status of your courthouse, your judge, your commissioners, and some key personnel that have also have been self-isolating due to exposure of COVID-19 from a county employee. First, let me assure you, I'm doing great. I'm fine, and I'm pleased to report, in fact, that I received my test results negative late last night, and my immediate household, my beautiful daughter Jackie, and the rest of my family all are negative here in my household. The other thing I wanted to share with you that I think is really important is that when we have this type of situation, we always want to keep you informed as quickly as possible. Our very first duty is to make sure that those people affected are notified and are given the opportunity to isolate so we can reduce the spread of any virus. In addition, we want to make sure that your work environment is as safe and secure as possible. And I'm pleased to tell you this, that your courthouse is safe, clean, and secure. What we have done is since yesterday afternoon, we first learned that there was an employee who tested positive for COVID-19. We immediately took action. We called an emergency operation committee of section chiefs, and that meeting took place yesterday late afternoon after work hours. What transpired then was a contacting of all of Nueces County employees that were directly affected. That means those employees that were in direct contact with the employee that tested positive. They were then told information that the health department relays to anybody who has that type of contact to please isolate, quarantine for a particular amount of time, depending on when their contact occurred. And then we made arrangements for them to have testing early this morning. By this evening, they will all have their test results and will be able to make a determination as to what other procedures and protocols need to be taken. Let me assure you that as of yesterday afternoon, we started immediately making the decision to clean and disinfect all the common spaces where this interaction occurred. What you mainly need to know is that there at no time was there any interaction between this employee and any of the public interfaces that we normally have going on at the courthouse. There was interface with Commissioner's Court last Wednesday, and we've made, as I said, those phone calls to make sure those people understand the nature of what they need to do to make certain that they and their family are kept safe. One of the concepts that we have all learned is how to work remotely, and we're doing that. So trust me, I'm on the job. I stayed up very late last night working, and I love it, and I've been able to work remotely from home using my unbelievable iPad, my networks of WebEx, GoToMeetings, and Zoom. We know how to work remotely, and we know how to work well remotely, and we will continue to do it over the next 7 days. Make no mistake about it. The business of the county will go on, needs to go on, and can go on very safely during this period of 7 days that I and the commissioners are in quarantine. If you have any questions whatsoever, I really want you to reach out to me. I'm on my email, barbara.canales@noisesco.com, or give us a call at the office. Thanks to Public Works and Miss Francis, our phones are being answered at 888-0444. In addition, you might be having concerns about needing to get tested. I know that what gives everybody peace of mind, what gave me peace of mind for myself and for my family, was getting tested myself. So what we've done today all morning long is help make arrangements so that county employees who feel that they would benefit by testing, even though they don't have any symptoms or any direct contact, we're going to make that available. We're working on the details now, and be looking for an everyone email sometime this evening so that you can have the directions that you need to make sure you can sign up for testing. And if you're wondering whether your family or your dependents might be eligible, they will. What we do to make sure that our employees feel safe and secure is make sure their families feel safe and secure. So we're going to make this program available to you and to the people that you care about. Finally, what I want to say to you is a great big heartfelt thanks. Thank you for allowing us to be a family together through this unbelievable crisis. Just yesterday, I held a press briefing in the morning at 11 o'clock, and I told everyone, I don't like this trend. We're seeing too many cases. I encouraged everybody to be more cautious, to recommit themselves to doing the right thing, to taking personal responsibility, wearing masks, limiting their travel, making sure that they're washing their hands for that 20 seconds, keeping that social distance, and all of the other protocols about keeping our home and our personal spaces clean and disinfecting as often as possible. All of these practices work. We know they do. If you believe, as I do, that working together we can suppress this virus, then I know we will be successful. But we have to make certain that the greatest freedom of all is our freedom to choose and decide how we want to live. I want to live in a space where everybody takes COVID-19 seriously, where we all engage in the types of behavior that will help keep us and our loved ones safe. So I'm going to ask you what I asked all citizens yesterday. Will you do your part? Will you help make certain that all the good work, all the sacrifice, all the times that we were kept away from doing the things that we love were worth it? I know that we have done everything in our power to make certain that we have the tools in our toolbox to do it right. Unfortunately, our courthouse had a situation where there was exposure. But I am certain that our courthouse can be a safe work environment. What we are doing right now is making it safer. Out of an abundance of caution, after already testing negative, we're going to continue this protocol of staying home, working remotely, communicating with you at every single update. I will make certain that you either have an email letting you know what's going on, or possibly even a video like this. I look forward to Thursday, June 25th, because that's the day that I get to come back, park in my space, walk through those doors, say hi to Miss Francis, say hello to SecOps and all the security guards, talk to my friend Sheriff's Deputy John Mellinger, get my cup of coffee, walk upstairs, and feel like I'm home again. I want you to know how much I appreciate all of your concern for everybody that you work with, and I share that with you. I look forward to making certain that we will prevail over this terrible coronavirus that's plaguing our country. I look forward to your ideas, suggestions, and as I said, don't be afraid. Reach out to me. I want to hear from you. So, I'll see you next Thursday or before on another video. Thanks again.
En resumen, la juez Canales está en cuarentena debido a la exposición por un empleado del condado de Nueces. Ella resultó negativo a la presencia del virus. Me complace anunciar que una vez que nos enteramos de que un empleado resultó positivo, comenzamos con la limpieza de todo el inmueble y también realizamos el rastreo de contactos de ese empleado. Asimismo, se llevan a cabo la toma de especímenes para determinar si alguien más pudo contagiarse. Aunque estoy en casa, continúo mis labores utilizando la tecnología y así lo haré por los próximos 7 días. Esta cuarentena es como medida de precaución. Para más información, si usted tiene alguna pregunta sobre los servicios del condado, puede llamar al 888-0444.
Okay, that concludes our briefing for today. We're going to take some of the questions from the media at this point.
Cool. Just kind of the first question is just the steps that the county is taking to increase testing supplies.
Testing supplies? Well, Annette, do you want to address that one? Testing supplies? I mean, I think what we're referred to as increasing testing, period.
Okay.
The judge has asked the health director, Annette Rodriguez, to put together a plan on how we can do testing every day. And she's working on that, and we'll have information soon, probably tomorrow or Friday, on what that plan would look like. So increasing testing, some targeted testing at the county courthouse has taken place, and we'll continue to, we'll have a plan tomorrow or Friday on that increased testing.
Okay. And there are other cities across Texas that have requested, like, signed petitions to Abbott of requiring masks again or installing another shutdown, et cetera, other movements like that. Is there any plans for Nueces? I know.
We'll continue to talk with the mayor and the county judge. We know that we're trying to learn what happened in Bexar County today up in San Antonio. So it looks like there's a mandatory mask if in public or in a business of sorts. And we're trying to. It seems like the judge there asked the governor if that could be allowed. The governor agreed. We need to confirm that. So that was late breaking today, but we're working with the judge and the mayor and his full council and full commissioners court to see what type of policy measures they'd like to put in place.
Okay.
Yeah.
That's it.
Okay, good. Thank you.
One more.
Yes, sir?
With the numbers growing, usually particularly in holidays, what's the plan for the 4th of July fireworks? Is that still a go, or are you guys going to look at the...
Right, yeah, so the question is the 4th of July fireworks. So we know that the city of Corpus Christi traditionally has our fireworks in the bay, and the mayor, in this case Mayor McComb, as an example with last year, there's a whole program of activities that take place from one end of the bay to the next, and that's coordinated by the mayor's office. There's a program and a lot of activities pretty much early morning all the way up to the fireworks. So what's going to take place this year is only fireworks. And so all the special programming, there has been a parade in the past. There's been venues at Water's Edge Park, at Sherrill Park, at all the way to the Texas State Aquarium. All those special programming features and activities have been canceled. And the only thing we're going to do is the fireworks. And I did want to commend Tom Schmid, who was planning on a small 4th of July event at the Texas State Aquarium. But last week, when he began to see the numbers coming up, he didn't even wait for this week. He decided to terminate that. And so that's another venue that's canceled. So no special event or 4th of July celebration at the Texas State Aquarium, and it's not because they don't care, but their executive director, Tom Schmidt, is a good role model who's adjusting business operations to facts on the ground. So we appreciate him for doing that, keeping people safe. In summary, it's pretty much fireworks only along the Bayfront, and no other program that the city's sponsoring for this 4th of July.
Just to follow up.
Sure.
What do you hope the people that go out there and enjoy these fireworks, what's the message to?
Right, yeah, so the message is, just like if they go to the beach today or if they go anywhere in a city park, is you still need a social distance. We've shown graphs that show risk, and the highest risk is in a small confined indoor space. There's still risk in the outdoors, that's the lower risk category. But you still want a social distance. You may want to wear a mask. In fact, I would wear a mask if I was you going out to see the fireworks, no matter how many people are around you, just because there may be more people than normal. So try to stay not in a group and stay away from people. Wear a mask. Keep your hands clean is the message. It's the same message we're using every Saturday, just as a plug for the city's sponsored fitness, Safe Fun Fit at the Bayfront. And so we're having more and more folks come out and use that venue. What we continue to tell people and show people by example is 6 to 10 feet distancing when we're doing some of the training activities. We also have more room for them to walk. And we're encouraging face masks. Some folks do wear face masks out there. So those are the key messages for the 4th of July. Just because it's a holiday and there's fireworks and it may be nighttime, that doesn't reduce any of the risk. In fact, it's going to increase them. Because of the number of people. So wear a face mask, social distance, hang out with groups or small groupings of people that you know. I wouldn't mix with people that you've never known. There's plenty of Bayfront, and because there's no special activities, there should be more room than ever to watch those fireworks. So that would be some of the message I would give for the 4th of July. Okay. Okay, good. So today is Wednesday. Tomorrow we will not be here, but Friday we will be. We'll have the mayor, myself, Annette Rodriguez, our public health director, and then Dr. Bird will be back for another briefing as well. And so we'll see you then. We'll be updating the numbers tomorrow, releasing them around 4:30, 5 o'clock. Our website, there's a joint city-county website that's updated daily that has numbers. A lot of the stuff I went over is on there. And then the presentation from Dr. Bird. Are you going to put that online, Dr. Bird? That's online. There's a link at our website if you want to see it again. So thank you. Stay safe. We'll talk to you Friday.